Okay, good afternoon. Good afternoon, everybody. Yeah, my name is Oduor Kevin. Sorry, I thought I was presenting, or the second presenter. This just got me, I was ambushed, but I think I'm just going to present. Yeah, as already said, my name is Oduor Kevin. I think they are waiting for them to put my slides to the screen. And I'm going to present on mHealth. And I don't know how many people have heard about mHealth. And I'm going to talk about how mHealth can be used to augment universal health coverage. So you'll have to forgive me a little bit on the weather, and I got some wisdom tooth extracted, so it's not really good over here. But I hope I'm going to do justice to my presentation nonetheless. Yeah, so I happened to conduct a study on mHealth integration into Kenya's health infrastructure to augment universal health coverage. Of course, this was looking at how that can be used to enhance service delivery. And this research was sponsored by WHO, and it was a call through the joint of which you have comprised for young researchers. And luckily enough, we are among the 22 African young researchers that were selected to, after sending the abstract, now to conduct a study and be able to publish that. So the research was published in the Southeastern European Journal of Public Health, and has since been used to inform mHealth integration in Kenya's health infrastructure. And one of the things that we're looking at is currently Kenya, the mobile penetration in Kenya right now stands at a whopping over 80%. And how can we tap into that mobile penetration to augment service delivery and also improve healthcare outcomes of our people? And even globally, right now, not only mobile penetration, but also smartphone penetration, right now stands at a whopping over 70%, with Kenya statistics, according to Further Africa, mentioned that Kenya currently it stands around 64%, which by 2030 or 2025, sorry, it's likely to get to 75%. And that presents an enormous potential for leveraging mHealth to augment universal health coverage. Of course, again, this research came against the backdrop of universal health coverage becoming one of the big four agenda, and the former President Uhuru Kenyatta using this as a launching pad for towards socio-economic transformation in Kenya, and also just ensuring that every other person may be able to access healthcare without having to experience financial catastrophe. And of course, that is the project title, Incorporating mHealth Intervention into Kenya's Health Infrastructure to Augment Universal Health Coverage. And if you want to access it, that is the digital object identifier, or the DOI, and you can access it. That is me without mask. Currently, I'm doing my master's at the University of Manchester through the Commonwealth Distance Learning Scholarship, and a bit of work experience with public health currently with soil, and also doing some work with the International Institute for Legislative Affairs, and also having done some consultancy work with the African Committee of Experts on the Right and the Welfare of China. Okay, so I've already mentioned what really informed this research, and as you can see, over 70% mobile penetration, that's globally. And it's also, as I mentioned, according to Further Africa, it's estimated that smartphone adoption right now is at 64% in Africa. And and 75% projected to be at 75% in 2025. And in Kenya, statistics, shows that it's estimated 80%. And for us, we saw this as an opportunity to, do a systematic review and, to inform, the integration of mHealth into Kenya's health infrastructure. And the purpose of the study, what we are trying to do is to understand what are the forms of mHealth solutions currently being, currently in Kenya, and also those that are already adopted globally, and also to understand, or just to get an understanding of the effectiveness of mHealth intervention, because one of the things that, according to the citations that we reviewed, effectiveness of mHealth intervention have not really been documented, or likely they are anecdotal. So we wanted to understand what are the effectiveness of, or what is the effectiveness of mHealth intervention, especially when deployed at scale, because most of them have not really reached the scale. We reviewed 29 citations, of course, using a strategy, and realized that only very few, very paltry mHealth interventions have really reached scale. So that's something that we wanted to understand. Sorry, before we get there, we also wanted to understand the barrier to mHealth intervention uptake, and also ways of integrating. Now that will come as a recommendation of how Kenya can now be able to integrate mHealth intervention or solutions into larger healthcare infrastructure. Good. Yeah, so what the methodology that we used? Of course, we used this is still the old slide, but fine. Prepared reporting items for systematic reviews and meta-analysis, or what we call PRISMA. And we follow that checklist, which provides us with an outline of how to conduct a systematic review. And also we did some search on CINAHL. CINAHL is the cumulative index to nurses and allied health literature, and on women, and utilizing people's framework. People's means population, intervention, and comparator, outcome, and also study design. So you use that one when you want to do a systematic review, and in terms of getting out of being able to form a search strategy to find the sources that you can use in your citation or in doing your critical appraisal. And also, we also use exhaustive search terms such as mHealth. Of course, that is not done on Ovid Medline. That's just a platform that is indexing researches that are done. So we use that one because it helps us now to get even the current studies that have been done on mHealth. And this was verified for academic rigor because we had a doctor on board, Dr. Benson Nyawadi, and he was just there to ensure that this research meets academic rigor, and also is verified for relevance and also authority. Let's move to results. Of course, the forms of mHealth, we found out that predominantly they are call centers, especially emergency call centers. When we were doing this research, it was just, when COVID-19 had just arrived in the emergency call centers, things like SMS being used for follow-up, SMS being used for reminder, or for disseminating curated information and quelling out these anxiety, especially during healthcare crisis or emergency. SMS and mobile apps have been really used, and we found mobile apps like MyDawa, we found mobile apps like NCD 365, which provides curated information on non-communicable diseases, So indeed, there are a number of healthcare, mHealth interventions that have been implemented in Kenya, but what we found out is that they have not reached scale. And that is something also we're interested in knowing why most mHealth intervention not reaching scale. Effectiveness of mHealth intervention, of course, what we realize that successfully we've used mHealth intervention to collect and transfer data, information, and also in just ensuring that there's also remote diagnosis where you don't need to go to the hospital. Because the essence of universal health coverage is to eliminate unnecessary traveling to the hospital, eliminate unnecessary meeting with the doctor, so that the doctor can spend most of his time only dealing or addressing critical conditions. And has also been useful behavioral and cultural change and adaptation of new, healthy, and friendly behavior. And a few challenges that we also able to spotlight there are things doing bureaucratic approval processes where for mHealth solutions to be integrated or to be endorsed, it follows a lot of procedures that sometimes you may end up giving up. So that was really a challenge in most of the citations that we reviewed, and security concerns in terms of privacy, because health care is very contentious and very sensitive topic, and so you can't just be sharing data. You have to actually get approval. So security concerns, and people are just paranoid, and they're asking, what are you going to do with the data that you're collecting? And so that's, and also language barrier. For example, some of the citations that we reviewed find that they are in other languages, maybe in French or in other languages that sometimes for those who, for example, the Anglophones, who can't be able to really understand what they're talking about. So language barrier is also an issue, because you have to also, what do we call it, translate this information into a language that other people can also be able to comprehend. And interoperability challenges in terms of the web interface cannot sometimes, when you're accessing maybe my DAO on your laptop, is different from how you're going to access it on your tablet or on your phone. So that interoperability challenges, affected what's called usability. So you're not able to really have the same experience when you're viewing or when you're accessing these platforms on your laptop, and also when you're accessing them on your phone. And that is also something that is an issue of usability, and we made a recommendation on how to address the same. And in terms of conclusion, of course, there are a lot of things that we covered, but I was just looking at spotlighting some of the things that we found out. And we concluded that there's enormous potential for improving healthcare access and augmenting UHC, because if UHC is all about ensuring coverage and also ensuring that people do not experience catastrophic or financial catastrophe, then we can use we can leverage the mobile penetration to be able to improve healthcare outcomes. And also, mHealth intervention must ensure efficiency, which is a component of usability. Efficiency in terms of the interoperability challenges, where you access a mobile health solution on your phone, and it's different from how you access now on your laptop. So those issues have to be addressed if, in case we want to integrate solutions into our healthcare infrastructure. Then there's also need for effective regulatory frameworks. Of course, I've seen Kenya e-health policy and Kenya e-health strategy, which is outdated because the last time it was updated it was 2011 to 2017. From that, we have not seen any update, or at least I've not seen any update. So, but The Kenya e-health policy is current. It runs from 2016 to 2030. So, but while what I was saying that while we have this regulatory frameworks, even in the principal document, the Constitution, we still need effective strategies to addressing issues to do with privacy and confidentiality, and to inform how to implement these solutions, because that is what is lacking. The Constitution, which is our principal document, just mentions this provision or provides for how to implement them, but it's not going into details. So that is what we say. We need effective regulatory frameworks to inform how to implement and how to ensure these solutions are adopted and they reach scale. And also find partnership with NGOs and those implementing ML solutions. Because most of these ML solutions are done by private sector or by NGOs. So government needs to be a very strategic partners in terms of ensuring they endorse these ML solutions and bring them to scale. And also in terms of increasing investing in technology and infrastructure, investing in cellular data or invest in internet, so that people are able to access these things without charging. Of course, that was me giving gratitude to Yale, which Enterprise, and also one organization, that is the APRO, for publishing this research. It was sponsored and fully paid by WHO. Is that the last one? Yeah. Yeah, so there are other recommendations that I put in the other slide. The recommendation that now we gave was that there needs to be nationwide sensitization or to deal with this misconception and myths around ML. Because if we are to integrate ML solution into healthcare infrastructure, then it means people have to really understand how ML can be used to augment universal health coverage. And because one of the things that we realize is that people think that ML is, we use the technical term, that ML is a panacea, meaning it's a remedy to all healthcare problems, which is not. And so there's a need for a government to conduct a nationwide sensitization to ensure that people understand what ML is and understand that this can help to really improve healthcare outcomes. And another thing that we also recommended is that government needs to really work on endorsing these ML solutions and also even partnering with them to ensure that ML solutions like MyDAO, which is here, NCDAP, or the NCD Alliance of Kenya was doing properly, how to ensure that these things reach their full potential. And I think just stop there. If you want to read more about this research, just I think maybe it will be sent to you guys, but just search ML integration into Kenya's healthcare infrastructure. You get it published at the Southeastern European Journal of Public Health. And those are my contacts. If you want to reach out, then you reach me through my website or my Twitter, Oduor_Kevin1. Thank you.
Thank you so much, Kevin Oduor. So up next we'll be having the plenary panel.